I'm Dr. Alecia Fields, and Kayla is our physical therapist who's wonderful, specializes in pelvic floor, and then Kendall is our wonderful pregnant patient that's volunteering for us. So just to get started, what we're going to be talking about is KT taping in pregnancy. And maybe some of you guys have seen like the sports tape used for athletes. And I just want to say, like, pregnant people are the real athletes here and the real Olympians. And so we should definitely give you all the support that you need. Some just basics about KT taping. It involves elastic tape that supports muscles, joints during pregnancy. The nice thing about this is it doesn't limit your movement. It's flexible, it's comfortable, and it's less bulky than a lot of those maternity support belts that we traditionally think of. And back pain is very common in pregnancy. So like almost half of pregnant patients experience some sort of low back pain or discomfort. And this can range to and include SI joint pain, pubic symphysis pain, and it can really impact daily life and just like overall well-being. So we want to give you some extra tools to help with that. Okay, just a few housekeeping notes. You just always want to test a small patch of tape before going too crazy. Some people are just more sensitive, and if you have any latex allergies, definitely look for tape that does not include that. And then just remember, in pregnancy, our skin is a lot more stretchy and can be more sensitive, and so you just want to be aware of that. And then usually you can wear your tape for about 2 to 7 days, and it's best if you can remove it in the shower while it's moist or with a wet cloth. There's lots of different brands out here. Kayla's recommendation is this rock tape, and just things to know about it are that you want to get the roll, not pre-cut strips, so that you can measure it to be what you need, and you can find it at Walmart, Amazon, Target, wherever you're shopping. And then lastly, application does matter, so you want to make sure that you're using proper techniques, and you may need help sometimes with application. So something that you can get your partner involved in, but that's why you're here, is to learn these techniques from a physical therapist. So these are the different techniques we're gonna go through today. And if you're here, I'm gonna take pictures of each as well, and we will make sure that at the end, I send you an email with all of the notes and pictures.
You want to get a strip that will go under your belly and almost through your ribs. Measure your strip, and on the edges that are square, if you just take your scissors and round off, it won't catch on your clothing and it'll stay on a little bit longer. So you take your biggest strip, you find the middle, and you rip down the middle here and pull a few inches, and then you want to put it right in the middle, rub, because the heat will activate the adhesive, and then you want to pull at an angle to the ribs. If you have it long enough, it can tuck under the edge of your bra, and that'll help it stay and not snag on your clothing. So this is the most common to help give your belly a little bit of lift, kind of like your partner lifting or you lifting your belly up. The next part gives you a little extra if your belly gets a little bit bigger. You want to take a piece, come just below the piece you put on, and measure to almost the top of your belly. So we're going to cut here. And for this one, we want our anchor to be just below that pink one. So you rip off about 1 inch of the backing. And I'm going to have you bring just the edge of your pants down for me. Perfect. You take this, and we're just going to put it just to the side, because we're going to run 2 of these up the front. I like to put them about 1 inch to the side of your belly button. Bring your backing to where you have most of the tape open. Give it a little pull, back off, and then run it right up the top of your belly, and then just tuck the top in. And then I always like to rub it to get it a little warm. And babies really like this. They get a little stirred up and start kicking and going crazy when we do this. And then for your next one, you'll do the same thing. You rip off the bottom piece. Come under, rub your end so it sticks. Give the tape a big stretch, back off a little bit, run it up to the top, And then let the end, don't add any stretch to your ends. It'll help them stay on a little bit better. And then give it a little run down the middle. Now, if you're doing this yourself, it's easier to do it in standing or kind of leaning back in a chair so you can hold your belly up with one hand, rub your tape, and then pull up. And then if you want to, I'll let you stand up and let everyone see what it looks like, and you can tell us how it feels. And you kind of see you got one big strip that comes to lift the bottom, and that one in the middle just gives a little more compression and lift. Yeah, it's so thin you don't notice it, and you can shower with it because the cotton typically, just pat it dry in the shower. It takes it a little bit longer to dry. You can take the hairdryer to it if you're in a hurry in the mornings. So it's really comfy. You can't see it under clothes typically. They make a ton of different colors. They make a nude color that if you're going to be wearing a white shirt and don't want to see through it, that you can do it that way. Just be cautious in the summer because it will leave tan lines if you have it on. We've had that happen to a couple of patients, and it's just really funny. I think the next one that we have to show is diastasis support. So sometimes during pregnancy, we'll have that midline discomfort or pain and separation of our abs. I went ahead and pre-cut our strips. So you want strips, and you want about 4 to 6 of them. And you want them to be 6 to 8 inches long, enough that are going to cross the middle here. You can do this one lying down, standing, sitting. I'm going to do it standing so that you guys can see. I may have you tip the screen just a little bit for us. So for this one, you're going to take the end and about an inch or so. And we're going to start on this side. I like to come just above the belly button, and you can do it anywhere that you're feeling pressure or you have that separation. And we're going to start. And you can do all of these together, but sometimes just one or the other can feel good. So we're going to start here. We anchor the end. We add a little bit of pressure, and we kind of come across and then let the end there. And for this one, we're going to do kind of a layering technique. Looks like a basket weave almost. And we're going to anchor this one here. Add a little pull, back off a little bit, and then run it down this way. If you notice that you're having discomfort at your belly button, or your doctor has told you that you may have some diastasis there, this can help, especially right there when it's kind of uncomfortable if you're getting up and down and moving a lot during your day. These we just kind of layer on top of each other. Add your stretch.
Is this something after delivery they can do too?
Definitely. I've had a lot of people use some of the bigger strips under because their belly just feels kind of like it's hanging or just uncomfortable pulling. And especially around their diastasis, if you had any muscle separation, when you're bending over to pick up the baby, or you're trying to lay down in bed and it's just really uncomfortable without so much pressure behind it. We're going to do a couple more so we get just a little bit more lower support. If you're really active and an athlete and you've noticed some doming or coning, you can add this to see if it helps as you use and activate your abs. And it can provide just a little more support than like a brace. It's a little too bulky for exercise doing this, but this will give you just a little extra support.
So your belly's going to look
Yeah, it's going to be, yeah.
good Easter color.
And there you go. Like you can do, this really gets babies stirred up. You can do 2, 4, or I did a full 6 here so you can really see what it's like. I tell everybody, practice and see what feels the best for you. You just want one coming from one side and one coming from the other to kind of pull together. You can do straight across. You can do this diagonal. And I've had some patients do almost like a star pattern with their belly button being in the middle of the star. Feel pretty comfortable?
Yeah, that's
good. It usually can, yeah. And if you notice like the little edge coming up somewhere, just rub it down. And then as you have it on and it warms up to your body temperature, it'll stick a little bit better. Yeah, she's all over the place. Yeah, she's all over the place. And I think, is our next one like diaphragm rib pain?
Rib and diaphragm.
Yeah. So during pregnancy, we can get some of this rib pain because our ribs expand a little bit to give a little more room for the baby. So a lot of times we can have some rib pain on one side or the other or across the top. One of the ways that can really help is grab your tape and measure just across the top of your belly instead of below your belly. And for this one, you're going to do the same thing. You fold your tape in half, find the midpoint, rip down the middle, and pull this way. This one is better in standing, where the one from the bottom is better when you're lying down. Pull through the middle, secure the middle, right under the bra line. And then you're going to pull down, follow the rib line down that way. And sometimes if you're having some of that trouble where it feels like you can't catch your breath or we're taking a deep breath is hard, this can give you just a little extra space and help. And it's just that one strip can really be helpful. Now, since Kendall already has a lot of tape on, I'm going to tell you and explain the next one, but skip adding like 4 more pieces. If you have one-sided rib pain, which can happen often, instead of doing across the middle, you can attach in front of where you're having the rib pain here and have your partner pull and run to the middle of your back. It can be really helpful if you feel like you just can't open up one side or breathe really good, one versus the other. Yeah. And you can do it on both sides and leave the middle open if you want to do it that way. Yeah. Not too bad.
Not too bad at all. It's actually really comfortable.
Yeah, it feels like a little extra support, like a compression short, but without all the bulk.
Yeah.
Yeah. I think next we have back pain.
Low back.
Yeah. And I pre-cut some of these strips so you guys didn't have to see us. For back pain, the most common way that I tape, you use 3 pieces of tape. I'll have you turn around for me if you don't mind. You want one piece that's going to go over the low back, and I like to bring it down to where it's almost over the top of the sacrum, kind of where your little dimples are above your butt cheeks. And then you want 2 pieces that are going to run up the top like this. We want them to run up beside the spine, not directly on the spine. So for this one, I'm going to have you step forward, and you're just going to lean forward a little bit, just like that. We're going to take our middle piece, rip it down the middle, stretch in the middle, apply low, and you can adjust any of the spacing with this on the back to where it feels the best for you. You can bring it low, below the underwear line if you'd like, or higher if you're having a little more pain. And then we take our support strap. And I like to start these at the bottom and lift up. Take your anchor piece. And I always like to anchor my pieces under an underwear or a bra line just so it holds for a little bit longer and doesn't pill up frequently. So we're going to come over to this side here. We're going to anchor. And I'm just going to slide that underneath. And then give a nice big stretch and then back off a little bit. Run it up here. And this can be really good if you're on your feet and you notice your back just gets tired really easily. This will give it just a little extra support down the muscle. And we have one more piece.
You need to make this like a required video for partners to watch.
This is,
How to support your pregnant partner.
so this is the only one you can't do by yourself.
Yeah.
I've tried it. It's really, really hard to try to do by yourself. All the others, if you are able to lay down, lay on your side, or kind of recline in a recliner or a chair, you can make it work. If you're uncomfortable laying on your back to put it onto your belly, you can do it standing. If you have your partner tape you, hold your belly up, take some pressure off as you tape, and it can be a little helpful. Try not to get your hair. There we go. And then just give it a little rub so that it sticks. If you have 2 areas that are really uncomfortable, you can add another strap here, wherever feels most comfortable. You can go ahead and set that up. Yeah, and it just gives you a little support.
Yeah, it does.
Yeah.
I can feel a little bit of a tug off my.
Yeah, and it'll pull just a little bit, like when we have it bent and we stand back up, it pulls the skin just a little bit and gives us a little cue to kind of help us stand upright a little better instead of how we kind of sink back when we're pregnant. We're trying to take some pressure off.
Right. Well, thank you guys for being here, and I thought we got our sound worked out. Sorry about that little hiccup in the beginning. I'm learning everything. So, is the back taping helpful for SI joint pain?
Yes, so you can do this and help for SI joint pain, or if you want to like specifically for one side versus the other, you can take a couple of pieces like we did for the diastasis in the middle and come across the joint here and do an X pattern. That can be really helpful if it's one side versus the other. If you're comfortable with it, you can come even lower with that bottom strip, right where you're having a little more of that pain.
How about pubic symptoms pain?
So for pubic symptoms pain, it's really difficult. You can tape just above the pubic hairline if you want to, but sometimes just lifting and taking the pressure off will take off some of that pressure. So this big one that comes underneath, and if you feel like, oh, that really helps, I need a little bit more, you can always add another one and come just behind and underneath and overlap at the bottom if you want to.
And these two long strips.
Yeah.
I feel like
Yeah, those two long strips
too.
come off to the side
Yeah.
here, and they can help, especially having some of that round ligament pain, and pull a little bit of the pressure off here.
Yeah, so you think you could use this even like earlier on in pregnancy?
Yeah, you can. Yeah, you can.
But maybe it's
You can use this even before you're really big, just to take a little pressure off of the round ligament, or if you're feeling just a little uncomfortable.
You can shower in it.
You can shower in it. Some people can get 5 or 6 days out of it. You just want to make sure you don't have on lotion before you put it on. Any other questions for us?